With regard to safety, we have been well educated, and hopefully, all of you or most of you have heard a lot of the information regarding the safety considerations with Bimzelx based on all the data we've had out there with plaque psoriasis. And there have been several studies, including comparative studies. So, plaque psoriasis does actually have comparative studies versus other biologic agents. We don't have direct head to head comparison studies. Um, with Bimzelx against other agents for hidradenitis suppurativa, nor for psoriatic arthritis or axial spondyloarthropathies. But we do have extensive safety data utilizing Bimekizumab at the 320 milligram dose, because that's what's used for hidradenitis suppurativa and plaque psoriasis. So we already mentioned to get the baseline TB testing and to do the baseline evaluation of liver function tests. Significant elevations in liver function enzymes can happen occasionally, not necessarily correlated with a true drug-induced hepatotoxicity. Recognize that those elevations are not unique only to bimekizumab and have been seen with other biologic agents that were used in the comparator trials for plaque psoriasis. So those are not just unique to bimekizumab, Bimzelx, in the hidradenitis suppurativa patients also with that consideration. Recognize that they're low, but they can happen. So that's why it's recommended they be previously evaluated. Suicidal ideation and behavior. My perspective on that is suicide happens in the general population. And actually, at least in our area of the country, those numbers have actually gone up from previous years. When you're looking at patients that have chronic diseases like psoriasis, hidradenitis suppurativa, psoriatic arthritis, and even non-dermatologic diseases, there is a greater percentage of individuals that have suicidal ideation and even sometimes suicidal behavior. So I think that it's important that we evaluate the psychosocial and mental status of our patients with quick questions when we see them. How are you doing? And even asking them directly, not only in the beginning, but throughout the course of the treatment, because a lot of times these patients come in showing us their best face and they don't necessarily tell us or our staff about that, even when they're familiar with our practice and they're familiar with us. So it's important to recognize that. There have been cases of suicidal ideation and very small number of suicidal behavior cases in the Bimzelx studies, and even with some of the other agents, they're low, but realize that possibility is there, and there's nothing definitive that states that the causative drug caused the suicidal ideation or behavior. It might be the underlying disease, but it's something we have to pay attention to. With anti-IL-17 inhibitors, we know that candidiasis, it's almost always going to be oral candidiasis can occur. Being that Bimzelx, we're using the higher dose, we're using it more frequently with hidradenitis suppurativa, the every 2 weeks to every 4 weeks, as compared to every 4 weeks or out to every 8 weeks with psoriasis and every 4 weeks with a lower dose with psoriatic arthritis. The hidradenitis suppurativa dosing is giving the patient more Bimzelx over a given time period. So the risk of oral candidiasis is there, and it's something that tends to be mild to moderate and is easily treated with standard antifungal therapy, such as oral fluconazole. So that is something that we look for. It can happen with other anti-IL-17 agents like secukinumab, which is also approved for moderate to severe hidradenitis suppurativa in adults, but the rates reported have been higher with Bimzelx, but typically easily managed. If patients develop a serious infection, or let's say develop herpes zoster while they're being treated, then you would discontinue the Bimzelx, get that an underlying disease state treated, and then have a discussion with the primary doctor on restarting the Bimzelx, it's not a contraindication to do so. That's something you decide on a case by case basis, including the patient's involvement with that discussion. If patients have active inflammatory bowel disease, it's recommended in the package insert that you not give Bimzelx. There is some evidence that inhibiting IL-17 with any of the agents, and certainly with Bimzelx, you can have a situation where you exacerbate or promote inflammatory bowel disease. So the package insert specifically states should not be used in patients that have active inflammatory bowel disease. It'll come in a carton, and the package insert states that there are two dosage forms and strengths that are available. There's 160 milligrams in a single dose pre-filled syringe that the individual injecting it will inject with a syringe, or a single dose auto injector containing 160 milligrams. There's also a 320 milligram syringe that can be a single dose pre-filled syringe or an auto injector. So it comes in two different dosages within that given syringe type. Make sure you know which one you have and that you're using it for the correct dose for the patient. But that's what's listed in the package insert. So in the case of hidradenitis suppurativa, if you have a pre-filled syringe or an auto injector that has 320 milligrams, the patient just has to get that single injection, usually in the anterior upper thigh or in the abdomen, at least 2 centimeters away from the umbilicus, given by the patient if they're properly educated, or by a caretaker, or can be administered by someone who's properly trained on how to do this in your office, either yourself, other clinicians, or your medical assistant or nursing staff. So that's very important. Now, the Bimzelx syringes come in a carton that are to be kept in the refrigerator. So you don't want to put them in the freezer. You don't want them sitting out on a heater or put in a microwave or sitting out in sunlight. You want to make sure they're properly stored in the refrigerator. Now, when the time comes that they're going to use the Bimzelx, you take the syringe out of the carton, you let it get down to room temperature, which might take, a half hour or so after it's out of the refrigerator. And at that point, it needs to be used within 30 days. So once it's taken out of the carton and out of the refrigerator and is at room temperature, it's good for 30 days, 1 month, 30 days. Do not put it back in the refrigerator. So if someone has taken it out, forgets to take the injection, they realize the next day they have it sitting on a counter in their kitchen. They could administer it within the 30 days, but do not put it back in the refrigerator. So that's important in terms of storage and handling. So that's basically it. I think this is a tremendous advance. It offers us excellent data based on how the studies were done, even giving us some higher bars of efficacy. And the safety considerations are essentially the same as what we've seen with Bimzelx for the other indications to date. So I hope that helps you. I try to be thorough and comprehensive in terms of what's meaningful to you, and make it a great day. Just make it a great day. And I hope when you utilize this agent for your adults with moderate to severe hidradenitis suppurativa, you find it to be as helpful as I have found in the clinical studies that we have done, even patients using long-term treatment. Thank you very much.